Engineering in association with the Academic Staff College. This FDP aims to provide a platform for educators and researchers to enhance their knowledge and skills in funded project application. To commence the proceeding, I request volunteer to deliver the welcome address and set the tone for the day.
Good afternoon, all. On behalf of the Department of Electrical and Electronics Engineering, in association with the Academic Staff College, it gives me immense pleasure to welcome you all to the second day of the Virtual Faculty Development Program on Funded Project Applications. I would like to extend a warm welcome to our speaker for today, Dr. Sendil Kumar, Assistant Professor in the Department of Biomedical Engineering at Savita University. As we all know, cancer is a leading cause of death globally, and early detection is crucial for effective treatment. The use of sensors in cancer diagnosis is a new wave in the field of medical research and has the potential to revolutionize the way we diagnose and treat cancer. Today's topic is sensor, a new wave in cancer diagnosis. And we are excited to learn from Dr. Sendil Kumar about the latest achievements in this field. I'm sure his session will be insightful and informative for all of us. I would like to express my sincere gratitude to Dr. Sendil Kumar for sharing his expertise and knowledge with us today. I also want to thank Dr. K. Saravanan, HOD of EEE, and the coordinator of this FDP, Dr. F. Fariza, Associate Professor, for their tireless efforts in making this FDP a reality. Finally, I would like to extend a warm welcome to all the participants. I hope that today's session will be enriching and provide valuable insights into the field of cancer diagnosis. Thank you all, and let's have a productive session. Thank you.
Thank you. Now, I would like to call Dr. Shivanand sir to deliver the chief guest introduction.
It's my pleasure to introduce Dr. S. Sendil Kumar, who is the accomplished assistant professor in the Department of Biomedical Engineering at Savita School of Engineering, Savita Institute of Medical and Technology Science, deemed university. Dr. Sendil Kumar is a specialist in wide range of fields including cancer biology, clinical toxicology, proteomics, tissue engineering, and biomedical instrumentation. Dr. Senil Kumar's research mainly focuses on identifying tumor molecular targets and developing tumor-specific antisense RNAi to specifically target cancerous cells. His enterprise in clinical toxicology involves testing drugs in vitro for apoptosis, cytotoxicity, genotoxicity, ROS, cell cycle, and gene expression. Dr. Kumar has conducted toxicoproteomics analysis to observe altered protein expression to predict altered pathways of various components drugs. His research work in tissue engineering aims to use 3D tissue equivalent for disease modeling studies in order to create a 3D organoid model for human and specific organ replacements using bioprinting technology. Dr. Sendil Kumar's research on biomaterials involves green and chemical synthesis of nanoparticles, nanorods, microparticles, and microrods to analyze their activities using various methodologies to apply for novel material synthesis. He has designed a novel neurostimulator device for Parkinson's disease studies with a goal of developing next-gen model. Dr. Kumar has also attempted to establish specific neurostimulator for consciousness replacement. Dr. Sendil Kumar is a member of Institution of Engineers and serves on the editorial board of International Journal of Biomedical Nanoletters and International Journal of Pharmaceutical Science Letters. He is also a reviewer member for Elsewhere Publications, Wiley Publications, Biomed Central Publications, and Omics Group of Publication. Dr. Kumar has received numerous awards and honors throughout his career. He was awarded the National Means Cum Merit Scholarship by the Directorate of Government Examinations, Tamil Nadu. He also received the Best Presentation Award at the Seminar Cum Exhibition of the Students Project Scheme held at KLN College of Engineering, Madurai. organized by Tamil Nadu State Council for Science and Technology. Additionally, Dr. Kumar has completed industrial training in production of milk and milk products at Avin, Madurai, and in leather manufacturing processes and effluent treatments at KAR Leathers Limited, Dindigul, and penicillin production by sugarcane molasses as a carbon source at SPIC Limited Pharmaceutical Divisions, Kodalur. Dr. Sendil Kumar has also undergone hospital training for departmental services such as biochemistry, immunology, microbiology, etc., with diagnostic services at Meenakshi Medical Meenakshi Mission Hospital and Research Center, Madurai. It is an honor to have Dr. Sendil Kumar as our chief guest, and I am confident that his vast knowledge and enterprise will enlighten us and enrich our understanding. We welcome you, sir.
Thank you, sir, for joining us today. I now request you to start your session and enlighten us with your knowledge and experience, sir. Sir, you are not audible, sir. Sir, you are not audible, sir.
Sir, you are muted. Sir, please unmute.
Now my voice is audible, ma?
Yes, sir.
Thank you, ma. Thank you, ma. I am already checked everything. Thank you very much for your nice introduction about me. I would thank your organizer, especially the head of the department, Dr. Saravanan sir and madam. Today's my topic is I will share my topics. Okay. It's not sharing, eh? This one. So your FTP is funded project application. So I will take research opportunities in biomedical field, and I will give my research knowledge about this biomedical fields. Okay. So my slide is visible to you.
Yes,
My
sir.
slide is visible to everyone. Thank you, ma. Thank you. What is biomedical? Can anyone know about this? Why biomedical field is now booming? Can anyone tell? Hello. Answering. If you interact means I will give more knowledge to you. Interaction is very essential. So you people must interact. Okay. Anytime you can stop and interact with me. Okay. So today topic is research opportunities in biomedical field. Okay. What is biomedical? Biomedical is the concept of medicine and engineering. You people are already know lot of medical instrumentation day-to-day life you are using. For example, scanning and all, you are using MRI scan, CT scan, various type of scanning equipment you are using day-to-day life. How it will be manufacturing in different countries. Either our country also manufacturing scan ray technology in Mysore. They are manufacturing lot of equipment, biomedical equipments. This medicine and engineering needed. You can clearly view some tumor. You have some tumor in your brain, or you have tumor in your stomach, or else you have tumor in your skin, or else you have tumor in food ulcer or tumor in your food. You can visualize the particular tumors in various part of your body. Then you can use the MRI scan. Then you can diagnose the what type of tumor present inside the particular area, either brain, lungs, lung cancer, or stomach cancer, or ulcer. You can predict what type of ulcer it is. You can use endoscopy for ulcer detection. You can use MRI or CT scan for this type of cancer detections. Okay. Okay, the concept of medicine and engineering, it's a very important concept. You can use the massive cancer, what type of cancer it is. Okay, you can see either MRI scan or CT scan or biopsy. You can use this type of medical instrumentations. Okay, the main purpose is therapy, diagnosis, monitoring to design, research, and using problem solving skill involved in with engineering. That is the main purpose of biomedical engineering. Okay, to solve the complicated medical problems. For example, the cancer, non-invasive cancer, it will spread throughout the body. Means you cannot easily predict. You can inject some drug, especially fluorescence drug. You inject some fluorescent drugs. With targeted drug delivery, you can insert some fluorescent tag into the particular drug. It will go and go into the bloodstream, and then it will show the fluorescence in that particular tumor area. And then you can take the image of the particular tumor. Then you can monitor either its tumor is where it is placed in. It will help to solve the complicated medical problem. You can detect this type of tag, fluorescent tag, you can use and predict the particular cancer mass. Okay, the current practical applications for this field is developing type of equipment in clinics and hospital for everyday uses. For example, you can using now COVID-19 time, you are using without touching temperature sensors. Without touching temperature sensor, you are using simply some distance. You can using temperature sensor. How it is possible? That is one type of biomedical equipments. Okay, and also nowadays lot of equipment like that. You can predict lot of different equipments without touching. Now you people are studying third year or fourth year biomedical engineer or electrical and electronics department, easy department. You are all studying in medical instrumentation or medical diagnostics instrumentation. This paper is available in medical diagnostic equipments. Medical instrumentation papers are available in ECE, EEE, and biomedical students. In that, particularly this comes under medical equipment. That sensor, that is the IR sensor used for medical temperature detections. Okay. Then lot of field you can use biosensors, bioinformatics build, biomechanics, biomaterial, biomedical optics, tissue engineering, genetic engineering, pharmaceutical engineering, medical imaging, clinical engineering, and rehabilitations. How one drug will appear into the market? For example, you are using one paracetamol tablet. Previously, they are giving only 250 milligram of paracetamol. Nowadays, you are using 600, Dolo 650 paracetamol dose. How it is possible? How they increase the dose? You people are know these things or not? Excuse me, my voice is audible. Nobody giving me the answer.
Sir, audible, sir.
Audible only. Okay. You are using this type of paracetamol. Initially, they are giving 250 milligram. Now you are using 650 milligram. How it is possible? The clinical engineering side is very important. The clinical engineering side is very important. First, you using dose level. You can fix the dose level for different type of clinical application. First, phase 1, phase 2, phase 3. For example, the COVID-19 time, we people are injected with COVID-19 vaccine, but the vaccine will appear after 6 months. After 6 months only, you getting that type of vaccine. Why this much delay happen in that particular vaccine injection? Because you need to trial everything. First one is in vitro studies. Then next one is clinical studies. Then clinical studies you can use in mouse or mice. Then use the human trials. These 3 different trials, then only you get valuable product of your vaccine, tablets, everything will come out. In this field, you can maintain the medical records, everything about even a single stage or formulation to your human study. You can maintain all the medical record. It will nearly take 1 year to 1.5 years. Due to the COVID-19 time, we need a vaccine. They will come out within the 6 months period. They will develop the vaccine, COVID or COVID-19 vaccine. This 3 steps: first in vitro studies, then clinical mouse studies, in vivo studies, then human clinical trials. Finally, the dose of your paracetamol will fix. Initially 250 milligram they fix. Now 600 milligram you can give for the adult ones. Okay, like that they fix the dose of our vaccine. They fix our dose of vaccine. Like you use different type of biosensor, biomechanics. Nowadays you can use the biomechanics. You can lot of persons using this biomechanics to sports persons using this biomechanic techniques and biomaterial. And nowadays a lot of biomaterial used for cephalog formation, image processing, novel materials, lot of novel materials, drug delivery system, and biomedical optics techniques also. You can nowadays using piezoelectrical crystal for optical. Piezoelectrical crystal used for lot of things. And tissue engineering feature is you can replace the organ. The main role is tissue engineering. You can replace the organs using any organs. A heart, you want a heart means you can generate heart. 3D cell culture model technique to use different type of hearts like that. Genetic engineering, genetically modified organism, genetically modified food, GMO food, a lot of things is nowadays available. You can use that one also. Pharmaceutical engineering, you can use this type of biomedical engineer for prediction of this image processing technique. Like that, you can use this biomedical engineers and the clinical engineering and the rehabilitation engineering. The job of the biomedical engineering options also involve the maintenance, testing, and the recommendation of the equipment. So, once you visit the hospital, you can see a lot of the equipments. For example, you can see in our ICU, CCU. What is mean by ICU? ICU, intensive care unit, CCU, child care unit. You can go and visit once. Most of the people you can in the time hospital, the ICU, CCU is the very critical care units because very sensitive area. Nobody allowed without mask, head cap, and aprons. Every doctors and every doctor and also nurses wearing apron due to COVID-19 time. Mask also they weared. Fully sterilized environmental should be maintained in the particular CCU, the ICU care. Here you are using multi-para monitoring and SpO2. You can give SpO2 and also you are using different type of diagnostic equipment, MRI scanning, CT scanning. These and all you people are seen in that particular ICU, CCU and critical care unit. You have any problem in that particular unit, you know about that problem, you can call the biomedical engineers. Nowadays, lot of the hospital, big hospital, Apollo, Savida, they everywhere having this separate department of biomedical engineering. Okay, the biomedical engineering field is booming. Lot of persons needed for this biomedical engineering field. Okay, then so what is the multi-para monitor? So for best example for the biomedical engineering equipments, you need to monitor one equipment to monitor nearly 6 parameters. Okay, the multi-para monitor is the medical device that measures the multiple vital signs such as blood pressure, heart rate, respiratory rate, and temperature. Previously, you used for temperature, you are using thermometer. For pressure, blood pressure, you are using a blood pressure machine, old type machines. Okay, and heart rate you can manually measured with help of stethoscope. Respiratory also you can measure in different. And SpO2 also you measured in SpO2 measurement. These all things comes under in one single equipment, that is the multi-para monitor. I think you people are already seen lot of movies. That movies, one person is admitted in the ICU or CCU. There some bitten or accidental person admitted in ICU.
Sorry to interrupt, sir. Your slides is not changing. Have you changed the slides, sir?
I change it, ma. It's not changing, huh? 1 second, I will change. Wait.
Okay, sir. Thank you.
So now it's coming.
Yes, sir. Yes.
It's coming or not?
Yes, sir. Now the slide has changed, sir.
So the best example is multi-para monitoring system. Now it's changing or not, no?
Yes, sir. It is changing, sir.
Okay, ma'am. Okay, you people already know about these things. For example, you people go and visit ICU or CCU. You can see this machine. Some persons they will put some surface electrode in the patient's heart side, and then they give the monitor, one big monitor, upper head of the patient. One monitor is there. You can see this different type of measurement: ECG, heart rate, temperature, innovative blood pressure, non-invasive blood pressure, respiratory rate, and SpO2, oxygen level. You can see in the single machine, multi-para monitor, you can see these things. This 6 parameter you can observe in the particular multi-para monitor. Previously, this you can use the different type of equipments like temperatures measurement. You can use thermometer, SpO2. You can SpO2 measurement, and non-invasive blood pressure method. You are using blood pressure cuff methods like that. So this type of biomedical engineer needed for this type of equipment repairing purposes. Okay, and also nowadays this will come in your single smartwatch. Okay, already you people are already aware of these things. Your smartwatch will help to monitor your heart rate and also how much calorie you burned every day. Each and every smartwatch having this type of activities. Okay, the Apple smartwatch nowadays you can monitor ECG waveform also. How it is possible to monitor in ECG waveform? Can anyone know these techniques? How it is possible? Can anyone know about these techniques? How to monitor this ECG in your smartwatch? Anyone know these techniques or not? So, okay, I will tell you. This ECG monitoring is, you need at least three lead system. You need to monitor the ECG, exact ECG. You need to put 3 electrodes, one right hand, left hand, and left leg. You need to put 3 surface electrode, and then only you can get the ECG waveform, PQRST waveform. Okay. But in this Apple Watch, they didn't use this type of ECG waveform. Okay, they use single piezo electrical crystal. You can see this slide. Backside of the Apple Watch, you can see some piezoelectrical crystal attachment. Okay, this attachment will help to monitor your blood pressure, blood oxygen level, SpO2, and body temperature. The Apple Watch 8 series initiated these things, and nowadays you can get these things: ECG, blood oxygen sensor, and a plus blood temperature sensor. You can easily monitor with your Apple Watch. How it is possible? Especially this ECG is very difficult. At least you need a lead system, so, single lead system, 2 lead system, or 3 lead system you need. I think most of the people, medical electronics or biomedical people know about the PQRST waveform. The exact peak within a second you can get one peak. Okay, within a second you can get one peak value. How accuracy this Apple Watch give? How it is possible? They are using simple 4 different type of crystal and sensors, IR sensor. The sensor in the backside of the Apple Watch, it will sense the IR and then sense your heart rate, heartbeat, how much calorie you burned, how much steps you are walked in, like that. Only one technique they used. They sense your heart rate, and then use the techniques. Worldwide, they are separated your heart rate. Even single newborn child to adult age, up to 60 age, they are getting data. That is medical data measurement. They are getting all the data within the 1 second. How much peak will generate in, like that they get the data. That is database management is now booming. Data science is booming. You can collect all over data, and then they incorporated the technique into the Apple Watch. This Apple Watch give 95% accurate ECG waveforms. 95% accurate ECG that waves. It will give 95% accuracy wave. Like that, feature in biomedical engineers, you need to monitor everything in a single smartwatch. That is the feature. Okay, you can think and incorporate a lot of techniques into the small smartwatches. I think ECG and SpO2, blood oxygen level, even though they are planning to incorporate your blood glucose level and glucose level to the Apple smartwatches. What type of sensor used in the blood glucose monitoring feature? You can see next slide. I will explain that one. Okay. So in a biosensor is a device. Okay, then go for the biosensor. Then multi-para monitor. Then Apple smartwatch. Then you go for biosensor. Everything comes under this sensing. The smartwatches comes under the biosensors. Okay, the biosensor is a device that measures the biological or chemical reaction by the generating signals proportional to the concentration of an analyte in the reactions. For example, analyte, bioreceptor, enzyme, cells, DNA, nanoparticle, like that. Then transducer. Then the transducer transduces the signal to the electronic devices. Finally, it will display. This is the biosensor concept. You take this smartwatch. The smartwatch having piezoelectrical crystal. It will process the IR, infrared, and then get the signal of your heart rate. Okay, this is the one example for biosensor. Another one example for biosensor, you can see it is based working principle of biosensor. Working principle is glucose oxidase, the major enzyme based biosensor. The biosensor was based on the thin layer of glucose oxidase and an oxygen electrode. The amount of oxygen consumed by during the enzymatic reaction with the substrate glucose. You can see this one. Nowadays, the diabetics is number 1 in the world. India is the diabetics number 1 in the world. You can see they prick single prick with a needle to insert the strip glucose. You can monitor the level of the blood glucose in that particular strip. Okay, this figure shows the simply you can prick it blood and then attach that the sensor strip. It will go and calculate that how much glucose oxidase will formed during this within the 3 minutes to 60 seconds. Okay, this is the best example for biosensor glucose. Now all people using this type of biosensors nowadays in the worldwide for monitoring blood glucose level. Then major another one thing is tissue engineering. Okay, tissue engineering, and the main goal is tissue engineering. I also use in this tissue engineering. Nowadays you can see the 3D bioprinting. Mechanical engineering using 3D bioprinting and civil engineering using 3D bioprinting for different purposes. For you want your face in your particular your cup, tea cup or a coffee cup, you want your face in that particular coffee cup, or either you want your face in that particular coffee. It is also nowadays possible. Okay, that is 3D bioprinting technology. You can use CATIA, the software, to generate the particular image in the software, and that image actually converted into this software converted into the printing, 3D printing, like a same shape. Like you want a cup photo with cup, you want coffee in your face, like that they will print. They will adjust the flow rate, they will give the raw materials, mixing, everything they will give. Finally they made the particular exact product. That is bioprinting. Right? The goal of tissue engineering is to assemble the functional constructs that restore the maintain or improve the damaged tissues or whole organs. That is the main role of tissue engineering. Okay, so using this type of bioprinting, 3D printing technology to our biomedical engineer using to generate different type of heart, lungs, and whatever organ you want, you need to print, you need to develop, and then you can replace that particular organ. That is, organ replacement is the main thing for this type of tissue engineering. Okay, first one is artificial skin. For a best example is artificial skin and catalysis. Okay, it is possible to generate artificial skin, and also this type of technique they are using stem cells. You can see the figure, tissue engineering, novel cell sources you can use, and then programmed cells also used. Cell culture 2D to 3D is also possible. Bioreactor techniques is also possible. In market they are generating blood, tissue engineered blood also possible, and also they are generating cloning. Using this tissue engineering they generated a clone. The Dolly is the first goat is they generated. Like that you can generate heart, lungs, and pancreas. It is also possible. And nowadays they are using insulin for diabetics. In future you have 3D cell culture technique and 3D cell culture model lab. You can generate your own pancreas with the help of stem cells. You can generate your own pancreas, you can generate own heart, you can generate own liver, you can generate own kidney. It is possible. It is the future. You people are working this area means you can generate this type of 3D organoid, 3D organs. It is possible. Nowadays the people are generating artificial kidney. They are try to generate this type of artificial kidney, artificial heart, artificial lungs, artificial pancreas. Okay, like that they are thinking to produce these artificial organs. Then you can main things nowadays they are knee replacement, and the arthritis problem is the very crucial problem. Lot of old age people nowadays insulin diabetic person easily affected with this type of arthritis problem. Okay, once diabetic comes each organ will destroyed due to the high glucose level. For example, first they will affected with your pancreas. Beta cell generation will stop. Then blood glucose level increasing. It will damage your metabolism. Automatically, eye problem, kidney problem. Once kidney problem rises, they go for dialysis problems. It will come. Urea creatinine level will increase. And then kidney problem will come. This arthritis problem will come. Lot of problem will come once diabetics will hit in your family history or hit in your family history or you. This type of problem will appear. And the time you can use this pancreas, artificial pancreas, or using this type of tissue engineering. Then you can use this cephalog formation of cups, knee cups. You can form the different type of cephalog for your arthritis problem. You can replace that cephalog with your arthritis areas. Okay, it is also possible. So the tissue engineering is booming field throughout the world. You can concentrate tissue engineering side, 2D to 3D cell culture model. In my research area, I used 2D to 3D cell culture area in Shanghai Jiaotang University School of Medicine. I cultivated HG2 cell, hepatic ulcer, HG2 cell, and then converted into the 3D cell culture model. Then I identify different, then I will give different type of drugs and identify the toxicity levels. Okay. Then we go for our collaborative research. Here I will join 1 year. I joined here. Before that, I worked in Sri Manakalav Nair Engineering College. I collaborated with Arupadi Beauty Medical College Hospital. Dr. Preeti Narajan is one of my collaborator. He developed smart bandage from collagen. Okay. What is the purpose of this bandage? So the bandage main purpose is wound healing. Okay. Bandage main purpose is wound healing. Okay. We go for that research. Introduction: as a component of connective tissues layer of extracellular matrix, collagen is the main. Collagen is an essential protein in the living body that forms the structure of bone, cartilages, capsule, joints, tendons, skin, scar, and nails. This is the main. Collagen is the main things. Okay? It's present in hair, skin, ligaments, tendons, nails, joints, cartilages, bones. Collagen distributes the different parts of the human body. Okay. Then you can use the tilapia fish have the main sources of collagens, and also eelfish, different type of marine collagens. You can see different type of collagens present in the living organisms. Different potential marine sources for collagen synthesis. Okay. So the tilapia fish and that skin itself having collagens. You can use that skin easily. You can collect the skin and then you can use for the wound healing purposes. This figure you can see marine collagen sources into the multiple properties of collagen, and it is various material adaptation for different applications. You can see this sponges, membrane, tubes, mesh, hydrogels, and drug delivery, tissue engineering, therapeutics. If it is possible, you can use the wound dressings. Okay, our purpose is wound dressing using smart bandages. Okay. In the past few decades, collagen has been considered as a significant material in the field of biochemistry, especially when it comes to the developing new way to synthesize the biomaterial with stunning capability for using in the medicines. Okay. The collagen material, based material in vascular, skin, wound, bone, cartilages, tissue engineering, and drug delivery. Already I told this one. For our aim is, objectives of our aim is to formulate a novel biopolymeric hydrogel bonded cotton patches coated with herbs and curcumin, aloe vera combination. You can make the wound healing bandages. You evaluate and check the safety level of that bandage to test the wound healing activity. Finally, we test the wound healing activity. Okay. How you people are already know this one Pungam, Pungamara, Cassia, auriculata flowers, and the aloe vera, natural. These are all natural. Cotton is the natural, and curcumin is the natural, and this one, banana thread is the natural. We use this thing to form a bandage. That is our aim. Already bandage is available, but the bandage are in a chemical in nature. Okay, we are planning to synthesize natural bandage, especially for diabetic patient. This one is that flower. Cassia flower is very important for the diabetic wound healing purposes. Okay, so we are concentrating wound healing with natural sources. Okay, finally we prepared the one bandage, herbal bandage, and then we give that bandage efficiency using different type of mouse. Okay, during usage of this mouse, we used anesthesia to produce the wounds, and then we included our bandage in that particular wound. Then finally identified how much level of wound healing will happen. Okay, I will tell about this hydrogel bound cotton bandage formation. First, pieces of pure cotton wool. You can collect the pure cotton wool in 16 to 6 centimeter square range. Okay, and then you can insert a particular cotton pad into the biopolymer, that cotton wool having cytosine plus that cotton, and then you can dip in that biopolymer into the 0.1 molar acetic acid plus 20% glycerol, and then it will go and dip into the cross-linking bath. Okay, and finally you can press that particular presser, 10-ton presser, to form the cotton pad, drying and form the cotton pad. This is the procedure, simple procedure. We followed the cotton pad formation. Okay, then we prepared the cotton pad, and then we induce the wound healing to animals. Okay, for wound healing purpose, Staphylococcus aureus we are using 5 into 10 to the power 8 CF per ml inoculated in the injured area of the animals. Okay, then we observed the observation of animals. Then we formed different 6 groups, each group having 4 animals. Okay, first group no infected group, second group hydrogel coated cotton bandage, third group plus cassia plant plus nanocompost plus hydrogel. Then third group collagen hydrogel coated cotton bandage with curcumin loading. Fifth group curcumin loading plus hydrogel plus that herb. Okay, the sixth group herb nanocompost and aloe vera loaded. Okay, we separated 6 different group of this pad. Then we introduced that pad to the animal. You can see how we created wounds in animals. It's very difficult to create wound animal handling. Once you do the research means you can did in vitro, in vivo, then go for animal study. Finally, you release the product. Then only all over world approve your products. Okay, we created this type of wounds. You can see in this figure, clear wound is appeared in that mouse. Then you can see group wise wound created. You can see that wounds work. Okay, then we introduce that our bandage into the particular wound. Nearly 21 days taken for full curing of the particular natural bandage. Okay, you can see this figure. 21 days. Finally, you can see the wound healing. Okay, day 3 you can see that figure. Day 1 you can see, and day 14 you can see gradually reduce the wounds. Okay, after 21 days, all gone. This is the process of wound healing. Okay. Then this is our summary. Okay. To summarize, a type of biopolymeric hydrogel bond, cotton-based compact patch were fabricated by a compression technique. The structural design of the such patches allowed to load different type of chemicals, drugs, nano or micro structured material to modify their properties. Okay, and incorporate the herbal. Not only provide the antimicrobial activity, but is also improve the mechanical strength of the patches. Okay, after loading of the curcumin, the antimicrobial activity, the incorporated patches further enhanced. All the patches possess good absorption capability. Use of the patches as a bandage material in the animal model, despite the efficiency of such patches as the wound dressing material. The loading of curcumin also incorporated patches should the maximum wound healing rate compared to the other bandage patches. Okay, so this is our result. Okay, you also create this type of bandage. Just you can creation of this bandage. You need simple materials, like we are trying simple materials. You can see aloe vera, that's pungam extracted flower extract, and cotton and fibers, banana fibers, curcumin. Okay, you can try different type of natural product to use this type of wound healing. Okay, natural bandage to wound healing. Thank you very much for your kind invitation. If you have any query, you can ask me. Thank you.
Thank you, boss. Thank you. Very nice presentation.
Thank you, bro, sir. So, nobody having question? So, biomedical fielding, nowadays we are planning to produce deep brain simulator. One group is in Manakula Vinayaka Engineering College, one student group involving deep brain stimulation for coma patient at pancreas disease. For one example, OK Company in film, that old lady having this type of disease, pancreas disease, short-term memory losses, and also in onion film, short-term memory losses, Gajini film, short-term memory losses. Okay, we are working in ancient days. In our people use this Varma Kala. Okay, the Varma Kala is famous one. Indian film they are using. They stimulate. They will insert two hands to stimulate that nerve system to eradicate some diseases. It's also possible. Okay, they will use two hands to eradicate, give the stimulation. The particular nervous system they are giving stimulation. Okay, and then eradicate some diseases, some pains. Okay, we are planning to introduce this type of stimulation, narrow, deep brain stimulation system, external system. You induce that system to particular nervous area. You can induce the electrical impulse to eradicate that stage. It is also possible, because in Varma, this two hand itself they are simply go for coma stage, and then they rectify that person with the two hands itself. They give some impulses, okay, and impulses to come out from coma, like that come out. We are planning to generate some external device for that one. It's very difficult. Which nerve system involving that one? Which area to you can induce that particular stimulation? This one group is doing that research. Another one group doing MGR, your university, Dr. Tirunavukarasu, doing some 3D cell culture model. Okay, I also give support and also collaborated with Dr. Tirunavukarasu sir for a 3D cell culture model. I will give valid suggestion to him, and also planning to propose lot of proposal writing. I'm planning to produce a lot of funders for that particular cell culture, 3D cell culture model has. Okay. I think someone asked in chat box. Only command is coming. You can ask some question. Okay. Professor, having any doubt, you can ask. Process. One side we are generating another type of results also. So your focus is we become a 3D organoid model development means it will very helpful in your future. Okay. If your heart is not working, you can simply like your bike is repair means you can change your tire, you can change your engine, you can change your bolt nut, everything like that. In future, you can change your heart, change your lungs, change your kidneys. It is also possible. Okay. Tissue engineering, 3D cell culture model. 3D printing technology is nowadays available. You can simply type it in Google. 3D printing technology, 3D printing model. The heart will be appear. 3D printed heart will be coming. That is synthetic one. We are planning to introduce a 3D culture model for this type of heart forming, heart organ development. Okay, they are using nowadays in cell culture. You are using DME medium. Like that, a lot of growth factors, growth hormones, and penicillin serum, antibiotic serum to develop the 2D cell culture. Okay, in 3D cell culture, you use it for different type of growth factors to develop the particular organ. Okay, and specific condition is required to develop the 3D cell culture lab. Soon, your engineering university will produce this type of lab. I also come and work there. Any questions you can ask. Okay, thank you very much. If you have any doubt, you can contact me. Okay, I will help you for your future research and collaborative research. Everything I know, your head of the department, Saravana sir, Tirunavakarsu sir, very well.
Thank you.
We are know very well each other.
Thank you.
Future we collaborated with work with you. People, biomedical
Research.
people or
Yes.
electrical people. Thank you.
Yes, Professor. Really, our project will collaborative. So in the future, we will join together.
Thank you, Professor. Thank you,
Thank you.
Professor.
Thank you, sir. On behalf of the Department of EEE and the Academic Staff College, I would like to extend our heartfelt gratitude to you for sparing your valuable time and sharing your knowledge with us. Now, it's time to deliver vote of thanks.
Good afternoon, everyone. It gives me immense pleasure to deliver the vote of thanks on the successful completion of the second day of Faculty Development Program on funded project application. First and foremost, I would like to express my gratitude to Dr. K. Sarvanan sir, the head of the Triple Department, for his valuable guidance and support in organizing this event. I would also like to thank Dr. Fariza ma'am, the coordinator of this program, for her tireless efforts in ensuring that everything ran smoothly. Special thanks to our esteemed speaker, Dr. Senthil Kumar sir, who enlightened us with their expertise and knowledge in the field. I would also like to thank all the participants who attended this program and made it a success. Your active participation and enthusiasm have made this event a grand success. A big shout out to all the volunteers who worked behind the scenes to make this program a success. Your selfless service is deeply appreciated. Finally, I would like to conclude with a quote that truly expresses our feelings of gratitude towards all of you. Gratitude is the fairest blossom which springs from the soul, said by Henry Ward Beecher. Once again, thank you all for your participation and support. Thank you.
Kindly fill the attendance which was posted in the chat. Once again, I would like to thank everyone for their active participation in this FDP. We hope that the knowledge gained from this FDP will be beneficial to all the participants in their future endeavors. Thank you all and have a great day.
Thank you. Thank you, Ma. Signing off. Thank you very much.
Thank you, sir.